Sometimes illnesses don't come with pain. They don't warn you with sudden weakness, cause a fever, or make you run to the doctor. They creep up quietly, gently, almost unnoticed. It all starts with a simple itch. At first it seems trivial, a reaction to washing powder, dry air, or new clothes. You brush it off, wave your hand, thinking it will go away. But it doesn't. And when the itch becomes a part of your life, it's no longer just an irritant. He signals. Over 30 years in the emergency room, I've seen hundreds of stories that all began the same way. People came in late. They remembered the itching had started months earlier, but they dismissed it. And too often, it was the last symptom before a terrible diagnosis. I'll never forget the words of one patient, a man named Ivan. He'd been complaining for a long time about an itchy back, especially at night. He was sent to a dermatologist, recommended a moisturizer, then to a psychiatrist, then home again. When he was brought to me in the emergency room, a CT scan revealed late-stage pancreatic cancer. He held my hand and whispered, "Doctor, the itching wasn't just an irritation, it was my body's last warning." Why didn't I realize it sooner? Modern research confirms that such cases are not uncommon. In 2018, the journal JAMA Dermatology published the results of a large analysis. People with chronic itching without an obvious cause had a 5-fold higher risk of liver, bile duct, and blood cancers than healthy individuals. And the most frightening thing is that half of the diagnoses were made at stages when treatment was already beyond reach. But it's not just the statistics that matter, it's the human habit of explaining everything away with trivial details. We tell ourselves it's probably allergies, the weather, stress, or age. We don't like to worry unnecessarily, and this is precisely our weakness. While we're looking for excuses, our organs are slowly deteriorating. Itching that persists for weeks isn't just a skin sensation. In medicine, it's called pruritus, a complex reaction of the nervous system. Beneath the skin are millions of sensory endings. They instantly react to any disturbance in the body. When something goes wrong, internally or externally, the nerve fibers transmit an alarm signal to the brain. The brain translates this into the sensation of itching, prompting the person to scratch to remove the irritant. If the source is external, this helps. But if the problem is internal, the liver, kidneys, blood, metabolism, no ointment will relieve the itching. The body won't calm down because the signal is coming from within. The filtration organs, the liver and kidneys, are the first to give such signals. When the liver can no longer cleanse the blood, bile acids accumulate in the body. They spread throughout the body and settle in the skin. Nerve endings react to them as if they were a poison. Severe irritation occurs, especially in sensitive areas like the palms of the hands and soles of the feet. This itching often becomes unbearable at night, approximately between 10 p.m. and 2 a.m., when the liver should be actively cleaning the blood. If you wake up at this time with an uncontrollable itch, this is a warning sign. Translated from Russian to English, www.onlinedoctranslator.com. I've encountered many such stories in my practice. One man, a 48-year-old senior manager at a large company, came to see me and said, "Doctor, my arms and legs are itching so much that I can't concentrate on work." The doctor at the clinic recommended a cream, saying his skin was dry, but the itching didn't go away. We ran tests, and it turned out he had chronic hepatitis B, which he'd forgotten about. The disease had long since progressed to cirrhosis. He started treatment promptly, and now he's living a normal life. When we met a year later, he said, "That itching saved my life." Cholestatic pruritus is one of the first manifestations of liver disease. According to hepatology institutes, it was the first symptom in 7 out of 10 patients with autoimmune liver disease. Almost all of them complained of itching in the palms and soles of the feet. Therefore, if these areas of the body itch simultaneously, especially at night, it's a reason to get examined. The second area worth being aware of is the upper back, the area between the shoulder blades. At first glance, it seems harmless. Dry skin, ill-fitting clothing, fatigue. But this is where the nerves connected to the lungs and heart run. Sometimes itching here is the first sign of a respiratory disease. A 45-year-old woman came to me saying it felt like bugs were crawling on her back. She had already seen a dermatologist and a psychiatrist, but no one had found the cause. I insisted on a chest CT scan. The results were shocking: an early-stage lung tumor. The tumor was irritating the nerve roots, causing this strange itch. The disease was cured because we didn't ignore the signal. Research by Japanese doctors shows that more than 20% of people with persistent itching in the upper back, for no apparent reason, are later diagnosed with underlying lung, heart, or spinal diseases. This is especially dangerous for smokers. Nicotine damages blood vessels, reduces tissue oxygenation, and the body begins to cry for help through the skin. One of my patients, a 58-year-old entrepreneur, had smoked for 30 years. For 6 months, he suffered from an itch between his shoulder blades. He dismissed the issue, blaming it on his age. His wife insisted on an examination. The diagnosis was early-stage chronic obstructive pulmonary disease. He now doesn't smoke and says the itch saved him, forcing him to quit. The third danger zone is the shins and ankles. This is perhaps the most alarming sign. If both legs itch from the knees to the ankles, especially at night, you should check your kidneys. These are the body's filters, purifying approximately 180 liters of blood per day. When a filter breaks, toxins remain in the body. Under the force of gravity, they concentrate in the lower legs, causing itching and irritation. According to statistics, the number of patients on dialysis has almost doubled over the past 10 years. Many of them recall itchy legs years before their diagnosis. A young woman, a programmer, worked nights for a year, living on energy drinks and painkillers. Her legs started itching, but she dismissed it as stress. When she was hospitalized, her kidneys were only functioning at 20%. The diagnosis was drug-induced nephritis. Now she's waiting for a transplant and undergoing dialysis 3 times a week. She told me, if I'd known that itchy legs could be such a sign, I wouldn't have let myself go. People with diabetes and hypertension should be especially vigilant. Almost half of dialysis cases are associated with diabetic nephropathy. If you experience leg itching, swelling, foam in the urine, frequent urination at night, fatigue, and loss of appetite, you shouldn't wait. We're used to thinking of the skin as just a shell, but the skin is a mirror of internal processes. It's the first to react to toxins, inflammation, and metabolic imbalances. And if it signals an itch, it's important not to suppress it with creams, but to understand the source. Sometimes itching is truly harmless. It can be caused by dry air, improper grooming, or seasonal changes. But if it returns day after day, lasts for weeks, and defies explanation, your body is clearly trying to tell you something. In such cases, you shouldn't delay getting an examination. How do you know when itching is no longer harmless and becomes a real warning sign? There's a simple rule I always repeat to my patients: 3 threes. It helps them stop in time and not miss a chance. The first 3 is 3 weeks. If the itching in the same area persists for longer than 3 weeks, with no apparent cause and no effect from creams, ointments, or changing soaps, you should definitely see a doctor. The second 3 is 3 zones. If itching appears in at least one of the 3 risk areas, the palms and soles of the feet, the upper back, or the shins, an examination is necessary. The third trinity, 3 tests: simple, accessible, but vital. A complete blood count, a complete urine analysis, and an abdominal ultrasound. These 3 steps allow us to detect more than 90% of dangerous diseases at an early stage, when they are still treatable. Too often, we go to the doctor when it's too late. But in fact, the body warns us in advance. And if you take these signals seriously, you can prevent the most serious illnesses. After all, itching isn't an enemy. It's the body's way of asking for help. And if you understand this language, you can save not only your health, but your life. Now let's talk about what you can do today to help yourself. Everything you need is simple and doesn't require expensive medications. Start with water. Pure water is the best natural filter. If you drink less than 1.5 liters a day, your blood thickens, toxins accumulate, and the load on your liver and kidneys increases. Don't drink in one gulp, but slowly, in small sips. Especially it's important to drink a glass of warm water in the morning on an empty stomach. It gently and naturally activates the liver and kidneys. The second habit is movement. Even 10 minutes of walking barefoot around the house or on the grass stimulates the nerve endings in the feet, improves circulation, and reduces inflammation. Our ancestors knew this long before science. Today, research confirms that light physical activity every day improves circulation, reduces the risk of diabetes, and helps the kidneys eliminate excess fluid. The third habit is sleep. From 11 p.m. to 3 a.m., the liver actively regenerates. If you're awake during this time, the organ doesn't have time to recover, and toxins continue to circulate. Try to go to bed before 11. This isn't just a recommendation, but a physiological necessity. The body follows rhythms, and by disrupting them, we interfere with the proper functioning of our organs. The fourth habit is nutrition. Reduce your intake of foods that increase inflammation and irritation of the skin. Alcohol, coffee, spicy foods, fast food, and sugary drinks. All of these increase the load on the liver and kidneys, make the blood dirty, and cause itching. Choose fish, rich in omega-3 fatty acids, green vegetables, and fruits with antioxidants. These protect cells and promote tissue renewal. The fifth habit is stress reduction. Chronic stress increases levels of cortisol, a hormone that damages blood vessels and increases inflammation. 5 minutes a day of breathing, silence, or a short meditation isn't a luxury. It's support for the nervous system. Sometimes the body doesn't need medication, but simply a chance to slow down. There's another term, golden time. In medicine, it's used for heart attacks and strokes, when every minute counts. But itching also has its golden time. If the cause of persistent itching isn't found within 3 months, the condition almost always becomes chronic or irreversible. This isn't a horror story, but a statistic. I remember a 62-year-old taxi driver. His palms and feet itched for 3 months. He thought it was eczema and bought ointments. One day he lost consciousness while driving. The diagnosis was late-stage liver cirrhosis. If he had seen a doctor when the itching was just starting, the disease could have been stopped. Keeping a diary is very helpful. Record when and where the itching occurs, how long it lasts, what you ate, what you did, and what time of day it gets worse. After a couple of weeks, you might notice a pattern. One 55-year-old woman kept a diary and noticed that the itching on her palms and soles of her feet intensified every night at the same time, around 2 in the morning. An examination revealed early hepatitis. Early treatment allowed her to fully recover. She later said, "Doctor, this diary gave me my life." Don't forget about heredity either. If your parents or siblings had liver disease, kidney disease, or diabetes, you're at risk. This is especially important for those who have ever received a blood transfusion, had tattoos or had piercings, uncertified salons. Viral hepatitis is often transmitted this way. If a mother is a carrier of hepatitis B, the risk of infecting her child is very high. Therefore, hepatitis testing should be mandatory for everyone over 40. As we age, the body becomes more vulnerable. The skin thins, the kidneys and liver function more slowly, and nerve fibers react more acutely. And an itch that seemed trivial at 20 can be the first and only symptom of a dangerous process at 60. Don't wait for your body to speak louder. You need to hear its whispers. I often hear older people say, "It's just age, doctor." But age shouldn't be synonymous with illness. One woman, 68, had been complaining of itchy shins for over a year. She was examined late. The diagnosis was end-stage renal failure. She was supposed to attend her grandson's wedding, but watch the ceremony via video link from her hospital room. Her words still ring in my ears. "If I had known the itching could be so severe, I would have gone to the doctor sooner." Let others not repeat these mistakes. The body never lies. It doesn't know how to express anxiety verbally, so it does so through sensation. An itch isn't a punishment, not an irritation, but a request. Don't ignore it. Regular checkups are the best way to prolong life. After age 40, have your liver and kidney function checked at least once a year, and after age 50, every 6 months. Tests and ultrasounds are inexpensive, especially compared to the cost of treating advanced illnesses. State-funded medical examinations are free, and additional tests are cheaper than a week's vacation. But, as experience shows, most people don't have time for preventative measures. While we live in a hustle and bustle, the body operates in patience mode. It can remain silent for a long time, but when its strength runs out, the itch sets in. This isn't a punishment, it's a last attempt to get through. And everything depends on how we react. I'm not saying this out of fear, but out of awareness. Yes, itching could simply be dry skin, but it's better to check 100 times and be sure than to be late once. Medicine has long ceased to be something inaccessible. Knowledge is open, examinations are accessible, and most importantly, paying attention to yourself costs nothing. When you feel your body sending signals, don't ignore them. Ask yourself 3 questions. How long has this been going on? Where exactly? And what have I done to understand the cause? This is already the beginning of the path to a solution. If you notice your family or friends complaining of an unexplained itch, tell them about it. Sometimes one phrase, one reminder can save a life. We don't live in isolation. One person's health always affects those around them. I'm making these appeals so that at least one person goes to the doctor before it's too late. So that at least one family doesn't have to learn that itching can be a harbinger of trouble. So that someone, after reading these lines, gets up in the morning and makes an appointment for tests. Let this text serve as a reminder. Your body never lies. An itch is a letter it's writing you, a last-ditch attempt to get your attention. Don't tear this envelope, don't delay responding. Your health can't wait until tomorrow. If this story resonates with you, if even a single word resonates with you, don't pass it by. Get tested yourself, tell your loved ones. Let at least one person, thanks to you, listen to their body in time. Take care of yourself, listen to your body, and don't be afraid to ask questions. Life is not meant to be lived in fear, but in awareness. And if an itch is a sign, let it be the beginning of change, not the beginning of illness. Before I close this page, I'd like to ask you for one simple action. If you've ever experienced an unexplained itch, or if you or someone you know has had a similar experience, please share your story in the comments. Perhaps your story will help someone recognize the early warning signs and seek help in a timely manner. Every comment under these materials isn't just words, it's part of a shared support network, a reminder that no one faces illness alone. We learn to understand ourselves and our bodies by sharing stories and listening to others. And please subscribe so you don't miss new episodes. There are no scares or promises of miracles here. Only calm, proven facts, doctors' experience, and simple steps to help maintain health. Your support helps us continue this work and create content that can truly change someone's life. Take care of yourself. Pay attention to your body's signals, listen to your heart, and don't put off self-care. May each day be a little calmer and safer than yesterday.